Hey everybody, it's Leon with Body Mind 360 Health and Fitness News. And in today's special report, we're going to be talking about the Health Club Armageddon. Now, gyms are currently reopening, but the COVID-19 pandemic has had a gigantic long-term impact on the health club industry. Your gym may never be the same. In today's video, I'm going to explain to you why. Now, while gyms are currently opening on a larger scale, I do want to point out that some gyms started to open up quite a bit of time back. And I actually posted a video that I'm going to reference in the description below, and as well will be popping up, talking about the reasons why you may or may not want to necessarily go back to the gym. And all that information is quite relevant still, so I implore you to check that out as well. Now, the gym and health club industry was hit especially hard during COVID-19. And the grim reality is that a lot of health clubs just may not survive. Some have already shut their doors. And to give you a perspective of where I'm coming from, I did spend multiple years as both as a personal trainer as well as a sales manager at a major health club chain a couple years back. So I have a real insider kind of perspective on how gyms function and their economic viability, as well as what can cause them to fail. I'm also not the only one that sees the writing on the wall being quite grim when it comes to the fitness industry. There's an article I'm gonna link. It has a major focus on the 24 Hours brand of fitness health clubs. Now, they've had troubles leading up to COVID, but this has made it all the much worse, and it talks about their impending bankruptcy case. In addition to that, they reference a marketing firm that did some research, and they're estimating not just a decline in the fitness industry, it's a landslide. It is literally an Armageddon level event, where they're estimating that the now $85 billion industry within this year is going to shrink all the way down to $45 billion. Now, that giant of a shrinkage when it comes to the size of the industry, it is a giant magnitude. This is, as I say in the title, an Armageddon level of shrinking when it comes to the industry. Now, there are two stacking problems that we have at hand here that I want to discuss. The first one is all about the health club industry's increased in overhead costs. So with the changes when it comes to COVID, the biggest expense that's going to increase is going to be the cleaning costs. Now, with the new guidelines, basically health clubs are required to clean pretty much 24/7. Now, this includes more staff hour requirements for the cleaning, more cleaning materials. Now, all of that is a compounding cost when you multiply it over a whole month of operation, for example. Now, while this is going on, we have to realize that rent doesn't drop. It remains the same for the vast majority of these clubs that do not own their locations that they're in. Now, I'm going to share with you a not so little dirty little secret of the health club industry. And it's probably not a surprise to you. Health clubs are absolutely filthy compared to most places you can attend. Even when they try to stay clean, because it's a situation where people go in, work hard, they're going to sweat, they're going to breathe heavy. Just people in general, some people come into the gym already dirty. It only exaggerates the situation. Now, before COVID, some health clubs, even the ones that had the highest standards, still by the standards of comparing of how much use equipment had, would still be relatively dirty by most standards. Other clubs had very lax guidelines because they had to keep their overhead low. So they only cleaned maybe once, maybe twice a day, or less, believe it or not. Some clubs really counted on members to clean up after themselves. And I'll tell you this much, from my experience of working at a gym for numerous years, when you ask that of the members, they just don't do it. Sometimes they'll do it here or there, but for the most part, the equipment stays sweaty, it stays dirty. So in the current state, you have a lose-lose situation for the most part. If you try and control costs by following the guidelines but minimizing the cleaning as much as you can to save money and stay profitable, well, then you have a really dirty gym. But if you're actually trying to meet those guidelines, you really are going to be spending a ton of time as well as money cleaning, and that becomes really expensive really quick. Now this leads into that second problem, and that is the changing in the member experience. And this changing in member experience is going to equate to less memberships and less revenue. Now, before I go into some specifics of how different types of members are impacted, there are some broad elements that will impact almost everybody. The first factor is capacity limitations. I always tell people, I used to tell when I was working at the gyms, that the hardest weight you're ever going to lift is lifting that door to open it, to get in the gym. And that is still true. It's hard to kind of get in the gym, but if now there's capacity issues, and maybe you got to set up an appointment to come to the gym, or you show up and it's full, or maybe your gym has limitations on how long you work out, that is likely to be a deterrent for individuals to want to work out. Also, with the guidelines, most, if not all, the group fitness classes are gone. If you're a parent and utilize daycare, like my wife and I do, daycare is currently not available, so that pretty much alienates those individuals that would normally be paying for gym memberships. Also, because the gyms are trying to increase the spacing between members, less equipment is available. It's being cleaned more often, so it's going to be unavailable more often as well during cleaning times. In addition, we have to deal with limited operating hours, so less hours to go to the gym. What if you worked out during those hours, like early mornings or later at night, because your work schedule? That might not work. Some gyms even have specific times during the day where they're going to shut down for an hour or two where they do extensive cleaning. Again, good for the cleanliness, but a big inconvenience for those people that needed to work out during those times because of their availability. And then there's wearing masks. Again, a big double-edged sword. Now, if you are in a state where it's mandated to wear masks in public spaces that are indoors, well, then you're going to have to wear a mask. And if you ever tried working out while wearing a mask, it's extremely difficult. A lot of individuals, they complain of having trouble breathing and functioning just sitting around at work, but imagine working out vigorously. So that's one issue. But what if it's not mandated? And if a club just recommends that you wear a mask? Well, I'll tell you, that means a lot of people will not wear masks. And now it's a different type of problem because the germs are now spreading and it's no longer a safe environment, almost automatically. So no matter what you do, damned if you do, damned if you don't when it comes to masks. So all of these elements discourage club use on a universal level, okay? But we're talking about so far members in general. I want to give you guys an even deeper look at the reality of the health club industry and why your club in particular may be in danger. So this leads me to the final big point I want to talk about, and these are the three types of members that will impact health clubs economically and whether they can survive or not. Now, I want to preface this by saying this is going to be a purely economic perspective. There's nothing like personal or humanistic about this. This is viewing as members as dollar signs, which is a necessity when we're talking about surviving and having revenue be greater than costs to stay in business. So I'm going to list types of members in order of profitability. The most profitable type of member is going to be what I call a quote-unquote whale. this is a terminology that I kind of took from individuals that purchase a lot of microtransactions on phone apps, a lot of these free-to-play apps and games, etc. That is a term that's used for a very small percentage of individuals that account for the majority of revenue on these apps. In a similar way, in a lot of health clubs, these same quote-unquote whales exist, but they function a little differently. Most of the time, these are the people that spend the most money on personal training. And as a personal trainer, I do believe there is great value in personal training, but again, it's not for everybody because it is expensive. It is the most expensive thing you're going to pay for at a gym, much more than your membership, much more than smoothies or protein shakes or protein powders. It is a huge amount. And so the members that pay for the membership and have trainers also statistically and traditionally spend more money on the smoothies. They maybe will buy the t-shirts more if the trainer recommends a certain supplement that's sold, maybe they'll buy that. So per person, they are the most profitable people at the gym as far as members go. And this is why a lot of times the gyms, they have such a big focus on pushing personal training, getting people involved, and spending that extra money to increase their revenue per member. Now, COVID impacted these individuals quite a bit because number one, maybe their income got impacted. And if it did, they're probably not spending as much on personal training. I remember back in 2008 when we had the recession, I had a huge stable of clients, and literally within a month, about 70% of them were gone. Because again, one of the first things that went when people lost tons of money was expendable income items like personal training. Now, of course, if they're not buying personal training, they're also probably not working out, or if they are, they're probably not buying the other things they used to buy. So those individuals either become way less profitable, or they may just quit their memberships altogether, and that's a huge hit to the gym. Now, the second category of members are what I like to call the I'll go tomorrow masses. I hate to talk about this sometimes, but the reality is that for a lot of gyms, especially kind of the mass market gyms, the ones that really rely on getting as many members as possible, they would absolutely love it if you only showed up from time to time but never canceled your membership. Because since your usage rate is low, you're not using as much of the equipment. They already know you're not going to be a traditional whale, so you're not buying personal training. So as long as you keep your membership, if there's that kind of illusion in your head that you might go, and you sometimes do go, then they're getting your monthly money, and that is a very profitable part of the membership base. Now the problem here is that with COVID-19, these individuals went from, oh, I may go, to likely, I'm probably not going to go, to I'm definitely not going to go. And so a lot of those memberships went from being there or barely being there to being gone. And that is a huge amount of profitability that's gone. Because those people were already on the fence, getting them back is very, very difficult. And this is one of the primary reasons why health clubs that really rely on very high numbers of membership bases, because their membership costs are really low, they're really struggling here. They really can't afford to provide that same value that they need to attract those members because their operating income at a base is really, really low compared to the more expensive gym memberships out there. Now, the final subgroup of members are what I kind of call the hardcore members. And that basically means these are individuals that just go to the gym on a regular basis, 3 to 5 days a week. The regulars, they have their systems of how they like to do things. Most of them are pretty independent and probably don't have a trainer. Some do, but statistically not as much as kind of the whales. So for them, they may really want to keep their membership. The problem is they're the least profitable as well. Now, it can get worse though, unfortunately, because if, for example, they like to work out 3 to 5 days a week and they go religiously in the mornings or at lunch or right after work, these may be times that are super busy or unavailable based on limited hours. And so they may literally be forced out of that membership, and they may go search for a different health club that does suit their needs, even if it's, for example, more expensive. Now, the major chains are probably not going to have a huge across-the-board change in costs. So what's really going to happen is that the members are going to just go and find a gym or a health club that's going to suit their needs. And those clubs that no longer meet those needs and are not able to adapt to the new standards of kind of gym operations are the ones that are going to critically fail. So as you can see by my examples, all three major subgroups are impacted to different levels. But because all of them are impacted, this is a huge, huge problem. And this is why it all compounds to the Health Club Armageddon. At the end of the day, it's pure economics. When your operating revenue that you can bring in is just less than those costs, especially since those costs go up, you are not able to stay in business. Now, not all gyms will fail in this crisis. The reality is that there are some highly effective, well-run gym franchises out there that were doing really, really well before this, and now they may struggle, but either through having room in their profitability to make this change, or through being reactive and being able to adapt to the new changes, they're going to be okay. But other gyms, either so big and so sluggish in their process to change to where they're not able to maneuver this crisis, or the ones that are just built around a system that no longer exists, are going to fail. Other ways of fitness will increase though. So at home workouts have dramatically increased. Unfortunately, so has the costs of free weight equipment, for example, and free weights have gone up dramatically because of the situation. Some specialty health clubs that really have always been low member count oriented, so specialty gyms that focus on personal training already are maybe able to adapt to those new changes and guidelines as well, because again, their higher kind of costs of attending those gyms may be able to absorb the higher overhead costs associated with cleaning, etc. Now, one thing is for certain in my opinion, there will be a new norm. And I don't know for how long these changes are going to need to happen, but I do think that there is going to be a permanent impact on the health and fitness industry. And there is going to be this decrease in the industry, and then it will expand again. Now, will your personal gym or health club survive? I don't know. I do know one thing though. When it comes to me and my family, I'm not taking any unnecessary risks. And I'm sorry to say to the gyms that I do have memberships to, that basically it's not business, it's personal. My name is Leon. This is Body Mind 360 Health and Fitness News, and I'll see you guys next time on your journey to a healthier body and mind.